Okay, so I've opened up my J-loop. We don't want to get this contaminant, so just kind of leave it in there. You've got a cap on this end. I've got my saline solution here, my little flush. I'll take off the cap, make sure I don't touch the end. You'll come in here and you're going to hold this. And this you push in and screw right there. And what we're going to do is you want to prime this line. So you'll push a little saline in there. See how it dripped out the end? So this is primed. You'll lay it down like this. I personally loosen the little cap, but make sure it doesn't fall off. And you'll see why, because your hands kind of get tied and stuff when you're in the middle of it. So I'm going to throw that away. Okay, got my Tegaderm. All right, so we've got IV catheter. We've got our J-loop. Don't need the gloves. I'm going to put my tourniquet back on. At this time, you can ask the patient to hang their arm, pump their fist a couple of times, and then they'll hold the fist. That will help this vein to pop up so that you can access it more easily. Okay, so I'm not going to touch it. Remember, we cleaned it. It's air dried. Got our Tegaderm. So we're going to go ahead and pop that cap off. So I'm holding it like this. I put my index finger on the little tab there. You want to put your thumb to anchor that vein back here. You're kind of going to go over it. You want to go at a 15 to a 25 degree angle. I've got my bevel up. And what I'm going to do, I'm going to start advancing into the vein. You kind of want to tell your patient. And if you can look back here, there's a little cotton in there. When we access the vein, it kind of suctions up some of the blood. And that little spot right there is called your flash. So that's what we're looking for. That lets us know that it'll turn red or pink. And it lets us know that we're into the vein. So I'm going to advance a little bit more. See how it's turning pink right there? It'll come back up, so that means we're in the vein. At that point, you want to advance just a little bit more, like 1/8 of an inch, because you don't want to go through the vein, okay? Now, I've got these two fingers, middle finger, thumb, holding it. And I'm anchoring myself to the arm. At this point, the only thing that's going to go forward is I'm going to push on this tab right here and advance the catheter into the vein. So I push that forward, hold that tab right there, and then click, snap, and we undo the tourniquet, okay? So we're in the vein. Everything's right there. This is where you hold it, you get your piece of tape. Remember, you've got that thin strip of tape. You want to take this, go over the catheter right here. Don't tape over the insertion site where you actually go into the vein. That's going to stabilize your IV, okay? At this moment, this is when we pop this off. You want to occlude the vein because I'm going to pull, stabilize the catheter. This comes off. You want to hurry up and attach your J-loop. Screw that on, okay? That's why we've got this here. And we can take your little 2x2 and clean this up. Because here in a second, we're going to put that Tegaderm in, and we don't want all this to be messy and stuff, because we don't want it to harbor bacteria. You can kind of put the corner, and then it'll actually get up into the threads. So just clean up the best you can. All right, we're stabilized. Now we're going to see if we're in the vein. So you'll take your syringe, you're going to kind of gently draw back. See how it came back in here? We're in the vein, so we're going to go ahead and flush. And you don't want to flush too hard. Some people's veins are very different. That might blow the vein. It might be too much pressure. So we're flushing really good. There's no resistance. You ask the patient, do you feel any pain? They're doing good. Okay, so we know it's flushed. So we're going to twist that off. You can put your clamp on. But we're going to take this Tegaderm, peel that back. If you see right there, there's a little notch. That's what's going to go right here. You want to go to the end of the catheter, but not on the J-loop. You don't want any air bubbles, so you'll press it out from the inside out. Okay. Pull the tape off. All right. Notice it has, you put your initials, credentials, the date, and this was a 22 gauge. You'll write that on there. Then you take this and you label your IV site. That's so anybody coming in will know what size it is. And you'll take your little J-loop here. You don't really want to tape over the insertion site because part of your assessment when you're coming in and checking on your patient is looking at the IV site, making sure there's no redness, there's not fluid back there, it hadn't infiltrated, anything like that. This part of your IV catheter will go into the sharps container. Any syringes will go in the sharps container. I'm going to save that syringe because we're fixing to use it. So that's the insertion of an IV site.